Hello, everyone. My name is Jacob McMaster, and my role within the business team is to be the project manager for the implementation of a psychiatric unit for mental health for the AZRMC system. So, purpose and rationale. My proposal is to add on a unit for the psychiatric mental health to meet the high level of need for mental health care professionals in the San Diego area. So according to the San Diego Workforce Partnership, there needs to be 25,000 behavioral health workers by 2027 to meet the growing population of the San Diego County. Recent data shows that 1 out of 5 individuals suffer from a mental health disorder. 70% of primary care visits are related to psychosocial concerns, and the COVID-19 pandemic increased the geropsychiatric hospital admission by 21.4%, but decreased the youth access to healthcare by 41%. Therefore, there is an increasing and ever-growing demand for mental health services. In addition, a systematic review of the pandemic's effect on patients showed a worsening of psychiatric disorder symptoms among individuals with pre-existing mental health disorders. There is a growing demand for mental health help among people suffering from substance abuse, depression, suicide, and gun violence. And although there is a high demand for mental health services, mental health nurse practitioners are still being underused. Therefore, we will be meeting the great need there is for mental health services in the San Diego area. Advantages include the accessibility to healthcare post the COVID era. COVID-19's increased telehealth adoption by 69%, thus increasing the healthcare providers' ability to reach out to all populations. In addition, insurance companies will pay out practitioners 85% of services for mental health services. Disadvantages include finding marketing strategies to reach out to the subpopulation living within rural areas. This is increasingly more difficult when rural physicians are decreasing the numbers of referrals and number of available mental health nurse practitioners. Okay, so for my implementation, the project implementation timeline will start with a gradual increase in the staff's preparedness to become fully operational. During the first month, we will train all employees regarding human resources, provider safety, cybersecurity, sexual harassment, fire hazards, and the potential for patient violence or staff protection, etc. Once the staff is thoroughly trained and ready to accept patients, we'll begin by slowly taking patients from the AZRMC hospital during the first month. We expect a slow patient load in the beginning month, which will help the staff adjust to the office space, provide time to resolve any bugs with equipment, and provide enough time for the staff to learn one another's workflow. During the second month, we will hire our admission counselor. The admission counselor will undergo 1 month of training. We expect by the end of month 2, the admission counselor will begin marketing for patients and making referrals to the clinic by month 3. In addition, during the second month, we will begin accepting additional outreach patients outside the AZRMC system without any other marketing. In addition, we hope by the end of month 2, our website to become fully operational and available on Google. By the third month, we expect our admission counselor to have developed positive relations with neighboring private practices and increase the number of patients seeking care at our facility. Month 3 will be the first month we'll accept clients from all avenues. During month 6, we will begin evaluating the success of our operation, determining if money is being allocated to the proper programs within our department, and if there is any need for budget cuts. If we have a positive cash flow and a surplus amount of patients, we'll begin hiring more psychiatric nurse practitioners as needed. For the remainder of the year, we expect to be fully operational and have developed positive relations with with and continue to expand and reach out to the community of San Diego. So just some of the costs and benefits of this proposal. In order for it to be successful, we will need to provide office space to be utilized by staff and clients involved in care. The office space will include the psychiatric nurse practitioners, medical assistants, and admission counselors. Some of the equipment involved include computers, chairs, desks, office supplies, printers, a scale for weight, and phones. The budget would include restroom toiletries and supplies for the break room for staff, such as a microwave, fridge, and coffee maker. All patients must be medically cleared before arrival, so there will be no need for diagnostic equipment. However, staff will utilize basic equipment to measure vitals before treatment and an automatic external defibrillator for emergency use. We will pay all employees hourly, except for the psychiatric nurse practitioners. Practitioners will be paid a percentage of the employees that are seen. This creates an incentive for practitioners to maximize the number of patients seen while maintaining profit. Practitioners can expect to receive 30% of the payment received by each client. The benefit of this includes providers continuing to see patients after hours if they choose to. Medical and dental will be provided for all employees. All employees will also have access to free mental health care services. According to the U.S. Bureau of Labor Statistics, the average cost of employee benefits averaged $11.48 per hour. Therefore, with all employees working an average of 40 hours per week, we can expect to pay $1,836.80 per month per full-time employee. Now, for our projected revenue, we have four sources of revenue, which is going to include Medicare, Medicaid, HMO/PPO insurance, and self-pay. Once we become fully operational, we can expect each nurse practitioner to see approximately 24 patients a day on average. Therefore, nurse practitioners will be reimbursed approximately $70 per patient. Therefore, we can expect a nurse practitioner to bring in roughly $1,680 per day or $28,980 per month. Each nurse practitioner will make approximately $347,000 per year. So in our business model, we will begin with 3 nurse practitioners for a more significant ROI for a total annual revenue of $1 million per year. However, our yearly revenue projection may be slightly lower as we expect a lower patient census in the first 3 months. We project to make 45% less the first month compared to the average monthly projection, 30% the second month, and 50% less for the third month. For outcomes and benefits, we expect to receive a significant ROI based solely on the number of clients we see. Based on the budget provided in the appendix, we can expect an annual profit of $180,000. Our incentive program for the nurse practitioners will allow our nurse practitioners to have the freedom to see as many patients as they choose. This will both increase the number of patients seen by our NPs, as well as provide them with the freedom to work at their own pace. In addition, with the use of a referral program from within the hospital, as well as the utilization of admission counselors, we can predict a large number of patients in need of our services. The flexibility of both telehealth as well as in-person appointments increases the possibility of more revenue as patients have an option of how they would like to be cared for. Benefits to the community. It's been found that the COVID-19 has caused an increase in anxiety and depression on a global scale by 25%. According to the Centers of Disease Control, 1 in 5 Americans will experience mental health illness in a given year, and 50% of people will be diagnosed with a mental illness or disorder sometime in their life. So there we expect the AZRMC psychiatric clinic to improve access to medical care and remain profitable. Our psychiatric nurse practitioners will fight mental illness, decrease the anxiety of our population, and decrease the rates of depression. With the implementation of our practice, we can increase the quality of life for people affected by drugs, alcohol, the pandemic, and short-term/long-term mental health issues. For my community marketing plan, due to the significantly large amount of individuals suffering from mental health disorders, the general target audience is vast and vague. Our target audience will need to identify and determine whether or not they are in a mental crisis and seeking treatment. Individuals of all stages of life may require assistance, especially those with chronic mental health disorders. Patients sought out, aside from those referred by the AZRMC, will be those referred by private practices or public outreach. It will be the responsibility of the admission counselor to be responsible for both private practice relations and public outreach. Marketing methods include being present at health fairs, schools, colleges, posting and utilizing social media platforms such as Instagram, Facebook, and Twitter, and building community relationships. In addition, our business will have pamphlets and cards readily available to hand out to interested participants. By having an active presence within the community, we want to engage with all people and offer our services. A website on Google is another resource that will have to be utilized by the AZRMC Psychiatric Services Program. Patients can access our website, allowing them to schedule appointments, cancel appointments, or reschedule. The website will also include the names of the psychiatric nurse practitioners, their education, and their mission statements to increase patient awareness and comfort. To obtain patients on the fence about receiving treatment, we will also regularly update any blogs, articles, and provide downloadable ebooks, which has been proven to increase patient retention. Lastly, our website will include the community programs we are involved in and contact information if patients are ever interested in calling our clinic for more details. And that's concludes my presentation on adding a psychiatric unit to the AZRMC system. I think that this is going to be very effective, and it's actually very possible to make this happen in the future. Thank you so much, guys. Really appreciate it.